In the previous video, I spoke about medial epicondylitis, or otherwise known as a golfer's elbow. And we showed you what we can do at the clinic in terms of medical acupuncture, dry needling, and soft tissue release. Now I want to share with you what you can do on your own should you have pain in your medial elbow area. Generally speaking, extension along those flexor muscles from biceps work or grips like deadlifts and or pull-ups. Simply grab yourself a lacrosse ball. Remember, the muscle extends from here all the way to here. Now, don't just focus here or just here. Try to roll the ball on the medial aspect and following all of those muscle fibers. Generally speaking, avoid the area where it's actually hurting or painful, where it's inflamed, and focus on all of those muscles into here. So simply find yourself a kitchen table or a desk or wherever you have at home, and then just apply a little pressure. You can add more pressure with the arm and just start in the middle of the muscle and work your way up to the top, and then definitely do the middle, and then work your way even to the inside. Sometimes you can also just apply pressure and move the arm gently up and down. That will also do the trick. The idea is to feel like a deep tissue massage or soft tissue release on all of those muscle fibers. Do that about 4 or 5 times a day, just a minute or two. When you're done with that, come up and gently apply a little bit of a stretch. And when you apply the stretch here, at times I would ask our clients to even turn your arm a little bit in one direction or the opposite direction. You might catch even more of a stretch. The idea of a stretch is not to force it too hard, just to gently move into those muscles and allow them to release and relax. Do that obviously on whichever arm is hurting, or even do that preventatively on the arm that's not even hurting yet to stay pain-free.